All right. Bismillahirrahmanirrahim. I think we're just going to go ahead and get started and people can join, can continue to join us. Assalamu alaikum, Dr. Anisa. It's good to see you. I'm excited to be here with everybody to talk about the 16th Annual Muslim Mental Health Conference. Hopefully we'll get a lot of questions answered today. But also, I really want to make sure that we give everyone as much opportunity to optimize proposal and abstract acceptance. We're very excited about the theme for this year. And we really can't wait to see everybody and really be inspired by everybody at the conference, inshallah. So what we're gonna do today is we're gonna start with the conference theme, just so that we're all on the same page about what really are we thinking about when it comes to the theme Tech No and Tech Yes. What kind of questions are we hoping that people will be answering? Also, to what extent are we hoping people will stay within the scope of these questions? And outside of that, we're going to talk about the different focus of presentations. Some people come in with research, some people come in with clinical work, some people come in with community work. And so when it comes to these different kinds of work that you do, what are we looking for in an abstract to really help us understand the work that you do? Then we'll talk about the types of presentations. So that's the kind of work that you do. What are the different ways, what are the different formats at the conference that you can present your work? And so there's four main ones that we have. Of course, as I share all of these, we really encourage we encourage all of our attendees and everybody submitting abstracts to be as creative as possible and just make sure to clearly communicate what your ideas are. Then we'll talk about the abstract writing standards. I have created just a little bit of a, throughout this entire presentation, you'll see very clearly what we're looking for in terms of each of the focus of presentations and types of presentations. But then when it comes to the actual abstract, I want to give you some tips on how to really optimize and really make sure that you're submitting an abstract that is going to get you the highest likelihood of acceptance. We'll talk then about the evaluation criteria. So you submit an abstract, what happens after that? How do we decide whose abstract gets submitted? What is the criteria that we use? But then also who are the ones reading the abstracts and who are the ones making these decisions. And then inshallah, I think we'll have enough time for question and answer. If you have questions about your own ideas and you want to know how can you tie it back to the theme, or you have extra questions about how you want to present your work, I'm more than happy to answer all of those questions within the next hour, inshallah. There's questions about whether we're going to have a recording for this for these presentations. So our goal is to post at least one of these recordings because we're doing this 3 times this week. We have another session tomorrow morning as well, if you know anybody that is interested in attending that one. And so we will have a recording. We will post it on our website as well for those who were not able to join us. All right, so for this year's, for the 16th Annual Muslim Mental Health Conference, the theme is Tech No or Tech Yes, the digital divide between Muslims and their mental health. And so for this year's conference, we're really hoping to really broadly examine the impact of technology on Muslim mental health and Islamic psychology. So you'll see that we're also collaborating and co-hosting with Stanford University's Muslim Mental Health Lab and Islamic Psychology Lab, which we're really excited about. It is their 10th anniversary. We're celebrating their 10th anniversary. And of course, we want to make sure that we incorporate Islamic psychology into the conference as well. And so when it comes to technology, we recognize that that's a really big, broad term. So this could be anything from the ways that we've used technology for community education and awareness, the ways that technology has impacted connectedness and community, the use of like applications, right? Different apps that we have on our phones or on our computers, and different innovations that people have used in regards to prevention, assessment, clinical practice, clinical care, and even research. And when it comes to the disciplines, this is the Muslim Mental Health Conference. One of the great things about this conference is that it's quite interdisciplinary. And so we're looking for diverse disciplines. Of course, we have social work, we have counseling, psychology, psychiatry, psychotherapy, but we also welcome individuals from health technology. In our last session, I had somebody who had a degree in computer science, and they wanted to submit an abstract. Also law, history, Islamic studies, Islamic psychology, chaplaincy. So we're really hoping that, to get a broad range and to really be inspired by the interdisciplinary reality of our cohort, of our field. So here are some questions that might help kind of jog. Some of you may already have an idea that you want to present. Some of you are kind of still thinking like, how can I kind of, how can I answer this question? How can I make my work relevant, or how is my work already relevant? So here are some questions that can be helpful to think about. In what ways has technology impacted the mental health needs of Muslims? What are the implications and consequences of increased use of technology? How has technology highlighted disparities and or fostered equity in access, quality, and effectiveness of care? How has technology shaped Muslim mental health and Islamic psychology through intervention, innovation, research, in research, education, policy, community work, and advocacy? How can Islamic psychology research harness the power of technology to be utilized by the general public? And what innovations from Islamic history produce artificial tools that improved the mental and more spiritual well-being of others? So as you can see, it's a pretty broad range. If your work does not exactly fit into these questions, we just make sure, I just ask that you make sure that in your abstract, you clearly indicate the connection between your work and the theme, which is technology. So there's kind of 4 different focus of presentations, or kind of different work that people can come in with. Of course, again, we're not limited to these, but these are general categories that do exist. And so in your abstract application, in your submission of your abstract, you are going to you're going to be asked to indicate which one of these most fit your work. So we'll go through each one of them, inshallah, and kind of talk about, okay, if you're doing empirical research, what are we going to be looking for in your abstract? What does your abstract have to include? If you're doing clinical work, what does your abstract have to include, etc.? So the first is empirical research. So empirical research is research where you have data and you are you've either collected data. I apologize, I do have a cat. Whether you may have collected data or you're analyzing secondary data, but with empirical research, there is data analysis that is happening. And so in your abstract, it must include sample characteristics. Who's your sample? What do we know about them? What is your data analytic plan? Are you using qualitative, quantitative methods? Are you using ANOVAs, regressions? Are you using, grounded theory approach to qualitative analysis? We do want to see a review of the results in your abstract. And so preliminary results are acceptable, but it is the case that in order to have kind of a higher chance of being accepted, we are going to look for some level of results that have already been collected. So that means that if you have an idea and you haven't collected any data yet, and this is just an idea and you're just sharing, what your potential data analytic plan for your potential sample characteristics, you are welcome to submit that abstract, but it is going to be you will have a higher chance of acceptance if you already have some data. And then, of course, having conference relevant research implications of your results in your abstract. So there's empirical research, but then there's also conceptual research, which is a synthesis of previous research. Maybe you've done a lot of reading on a certain topic and you're like, I'm synthesizing all of the research that exists around this topic and I want to present that. That is also welcome. And so in that abstract, we're going to be looking for a synthesis of the previous relevant data, clear conceptualizations of the new ideas that you are bringing to the presentation, and then of course also conference relevant research implications. You'll see these implications are going to exist in every single one of these abstracts because we really want to make sure that you are presenting something and clearly indicating this is what can be done with the work that I've done. This is how it can be moved forward. And then we have clinical work, right? It is a Muslim mental health conference. And so we have a lot of individuals that have their own practices that are either, working in a private practice or a hospital or in a lot of various capacities. And so if you have kind of clinical work that you want to present, so for example, last year we had a clinician come present on a case study of somebody in her private practice. We had another person present on a series of cases, and they've noticed that there's maybe a theme in regards to the things that are showing up in their clinical practice. So for example, right, if you work with young people and you're noticing that there's technology addiction and you've tried to use various interventions and you want to kind of present on the interventions that you use, the ones that have worked and haven't worked, that would be a wonderful addition to the conference. And so in your abstract, we are going to be looking for the presenter's area of clinical expertise and qualification on the selected topic, right? So we want to see that they're a social worker, you're a licensed social worker or a psychiatrist or a chaplain at a university setting. And then the method of synthesizing that clinical practice information. So is it that, you're going to go over some interventions, or maybe, we'll talk about the different methods of presentation. Maybe you want to have a community conversation with other clinicians about, these are issues that I'm seeing in my practice. How can we brainstorm together on different interventions that we can come up with and be creative about? And then, of course, clinical practice implications as well. And then the last focus we have here is community work. So, this is an academic conference, and we recognize that in order for us to really, think broadly about the impact of our work and the impact of the work that we do in our communities, that it's not just in the research lab or in the clinical room, that in the community is where a lot of the work, especially when it comes to Muslim mental health and Islamic psychology, does. That's that sometimes we have to take the work from the labs and from the clinical rooms and really take them to the community. And so we really encourage individuals to, submit conference relevant community work and policy implications. So some examples are maybe a community program that you've done in your community, and you want to bring it to the conference and actually facilitate a workshop that you have done in your community, or you want to present on a series of ideas that you have taken into your community and implemented, and just to kind of present and inspire other clinicians and other workers in their communities. Strategies for professional development as well, right? We have a lot of individuals in our communities who do a lot of community education. And so maybe thinking about okay, how do you have an online presence once you're, as you're doing community education, for example? Innovative ways of serving the community to improve mental health needs. So really, we are looking to be inspired, where there's so many wonderful creative ideas that people are already kind of utilizing. And so we want to make sure that we bring this as a hub, inshallah, for the conference. So, okay, so those are the types of works that you might be doing, right? And you might be wanting to present. And so let's talk about the different methods of presenting, the types of presentations that will actually exist. What are the different formats in which you can present your work at the Muslim Mental Health Conference? And so the first one is an oral presentation. And this is kind of the more traditional academic conference setting, right? So you have 15 minutes to just orally present. You stand in front of of the room, and you're just presenting your work for 15 minutes. So for all oral presentations, they will be combined into panels by the organizers. So the organizers, once all of the abstracts are accepted, we will create panels based on similar themes. And we will also assign a discussant for each of the panels, who will, at the end of the series of presentations, will engage the audience in question and answer, and also engage the presenters in common themes that they have kind of realized or recognized in your presentations. So that's the oral presentation. That's kind of the first traditional type, oftentimes the most common type of presentation that individuals engage in. And then we have a poster presentation. So for the poster presentations, we're going to have 1 hour during the conference when all of the posters will be physically present, and everybody will have a chance to walk around the room and look at the different posters and read different research that people are doing. We expect that if you are submitting for a poster, that you will be physically present, standing in front of your poster, so that as people are walking around, they are asking you questions and are engaging you in the research that you've done. All of the poster presentations will be printed by Stanford University. And so once an abstract is accepted for a poster, we're going to send detailed information on what are the standards for printing for Stanford, and also what are the kind of tips on how to create a poster. And so on the poster, you just got to make sure that you're highlighting key information, rationale, goals, methods, outcomes, right? And again, any of the work that we've presented, any of the kind of type of work that you might be doing that I talked about earlier, can be presented in a poster. Now, we really want to make sure that we're really being as engaging as possible in this conference. And so I really recommend individuals to engage the audience at the conference through community conversations and workshops. So for community conversations, these are a 45-minute audience-engaged conversation on a key hot topic or timely issue related to Muslim mental health. And so, for example, There has been quite a bit of research recently on porn addiction, right, which is definitely related to technology in the Muslim mental health field. And so that could be a conversation on how is it kind of showing up in our communities. And if you recall my conversation earlier about clinical interventions that are used, this could be a conversation with other clinicians on what are strategies that you've used, or what are things that kind of need to be done in the clinical work. So in the abstracts, if you are doing a community conversation, you need to make sure that you are highlighting the importance of the topic and clearly indicating the key discussion questions. This is really important. Previously last year, we had individuals note that they were going to do a community conversation, but we didn't see any key discussion questions. And so we could not accept it as a community conversation because it really looked like an oral presentation that you were just going to come and present your work. So we need to see the key discussion questions in your abstract in order for us to have a clear understanding that you understand the format of this. And we also want to make sure that if the audience members are coming in and saying, I want to go to this community conversation, that they will be engaged in conversation with you about that topic. And then the last type of presentation is a workshop. And so in a workshop, this is 90 minutes, interactive, experiential, skill building session that offers participants a chance to try out a new method. So as an example, if we're trying to be creative here, this could be, somebody comes in to help facilitate creating a brand for yourself, creating a social media brand for yourself in order for you to like build your practice, right? Maybe that's an expertise that you have and you want to provide that as a skill for individuals at the conference. That would be a wonderful way to use the time. Other ideas are maybe there is a list of like telehealth services that you feel that, maybe you've created a telehealth service and you want to kind of walk people through an idea, going from idea to execution, on that telehealth service. Some other ideas we have here are self-care strategies, right? Because we also need to take care of ourselves. And so we want to really be thinking holistically about Muslim mental health is not just our clients and the people that we're working with, but also ourselves, right? Which is a beautiful part of this conference as well, is that we're all there together, working for our community and also working for one another. Maybe you have a new data analysis method that you've used in your research and you're really excited about sharing it with the audience. Maybe there is a teaching approach, a pedagogical approach that you've used. Maybe there's a type of a activity or a workshop that you've done in your class, and you feel like this would be a really great way to kind of, other teachers, other professors, other instructors could use in their own work. Or a presentation on a workshop on how to write a policy brief, right? How to communicate to politicians or policy experts, for example, at the conference. And so we really want you to be creative. And I also want to say that we don't want you to be limited to these types of presentations, right? Last year we had a film screening. So someone brought in a film and it was like a short film, 15, 20 minutes, and there was a discussion afterwards. If there's like an art type of workshop or thing that people want to do. So really think creatively. We're really excited about the ideas that y'all are all bringing to the conference, inshallah. Now, when it comes to writing the abstract, we do have a 300-word maximum on the abstracts, which means that your abstract can be 150 words, 200 words, but really what we're looking for is the content. Are you answering all the questions that we asked for you to answer? So in the first sentence, and this is really key, in your first sentence, where if you want to really optimize your chances of getting accepted, it needs to introduce your idea and directly connect it with the theme of the conference. So first sentence, that's the first thing that someone is reading is, I'm trying to think of an example off of the top of my head, but let's say that, maybe you make a mention of like the mental health crisis, the youth mental health crisis, right? Or the suicide rate, the increasing suicide rates And maybe you have some data on the Muslim hotline, right? And you want to present that data. So you're clearly kind of talking about the technology piece of it and also your idea, and you're kind of connecting it to the theme of the conference. Now, the body of the abstract is going to depend on the type of research and the focus, the type of work and the focus of the work that you're doing, right? So again, if you have empirical research, we're going to be looking for the sample characteristics. We're going to be looking for a review of your results, etc. So everything that I've already kind of shared. And then the end of the abstract, and this is very critical, every abstract, we're really looking for implications of your idea to the Muslim mental health field and to Islamic psychology. And so how is this new idea contributing? So for example, if we stick to the the youth mental health crisis or suicide rates, some of the implications might be, this presentation will assist clinicians on how to best utilize hotlines for Muslim clients, right? Or this presentation will indicate the ways that researchers can use this measure or this scale in order to more accurately define depression through through like telehealth services, right? So things like that, right? Just kind of throwing these off the top of my head, but really the work that we do is, so like I said earlier, very interdisciplinary and very broad. Now, when it comes to the evaluation criteria, who is going to be looking at these abstracts? So you may have gotten an email or you may have seen a message about a call for abstract reviewers. So we are using a peer review format, which means that the people who are going to review your abstracts are your peers. And so that's what makes, this conference like very exciting and really a community effort, is that we are all deciding and choosing what is important for us and what kind of conversations we want to be included, what kind of conversations we want to see at the Muslim Mental Health Conference. And so every abstract is going to be blindly reviewed by 2 different reviewers. So that means that your abstract will be taken. If there's any identifiable information, that will be taken out of your abstract. Each abstract is going to be sent to 2 different people who don't know each other and don't know who wrote the abstract. And they're going to be given, what I'm going to show you is the evaluation criteria. And so they will be given all of the information that I previously shared with you around what are our expectations of each of the types of abstracts. But then also they will be given this evaluation criteria. And so each person will then rate each abstract based off of this evaluation criteria. Their scores are going to be averaged and assigned to that abstract. And then all of the abstracts will be kind of ranked from highest score to least to the lowest score. And so one of the things that we kind of need to, and it's for transparency, one of the things that we need to really be mindful of for every conference, because every year the conference is in a different space, is how much actual physical space do we have? Do we have room for 45 oral presentations and 10 workshops, or do we have room for 100 workshops and 30 oral presentations? So as we finalize the physical rooms that we're going to be in, and determine what is the actual space, that's going to tell us what is the cutoff going to be for the abstracts. Where are the abstracts are we, how many abstracts can we actually accept? So let's talk about how these abstracts are actually going to be evaluated. So there's the following criteria. The first criteria is relevance, integration of the conference theme and your abstract. Does your abstract answer, is it related to the conference theme? So you might have a really good idea, a really cool idea, but it's just not related to the conference theme. You might be, your abstract might have a very low score in regards to relevance. So that one's going to be a very simple one, which is why I say your first sentence and your last 1 to 2 sentences should have very clear implications connected to the theme in order to really optimize that you get the highest score on relevance. The second is timeliness and potential impact of the topic, right? So we want to make sure that what you're presenting is actually really relevant to what is, I don't know if I cut off, but we want to make sure that what you're presenting is actually really relevant, right? So for example, it's hard for me personally to think of topics that are low on importance because I think everything is important. But say, for example, you wanted to do a presentation on, well, I'm gonna say you, but say there was an abstract that said, people's favorite colors and maybe the colors that they choose to post on their brand is going, impacts how much engagement they get on their online community, right? That is interesting, right? Like I feel like I would probably read, an article about that just to kind of be interested in it, but it's not timely. It's not, there isn't a potential impact of the topic on the conference, right? So think about like how important is this to the audience that's coming to the conference. Then, of course, there's merit, right? To what extent are the methods that are utilized sound, rigorous, and ethical? That's going to be really important. So if, for example, you're presenting on some clinical work and, so the way that we're going to be matching some of the abstracts is we're going to be matching this kind of the theme of the abstract to people who are experts in that field. So for example, if you write a clinically based abstract, we're going to send it to clinicians in order for them to be able to determine if they find it sound rigorous and ethical, as an example. So that's going to be then definitely dependent on the reviewers, but we really want you to make sure that as you're writing it, you are very clearly indicating, right, the rigor of your work and in your abstract. The fourth is coherence. So of course, if we can't read your abstract, if we don't understand what you're saying, that's going to be a really important indicator. So your idea might be good. And I will tell you, I've read abstracts last year where I'm like, I feel like I get what they're trying to say. And I feel like this could be a really cool idea, but I don't feel confident in that they actually, like, I don't know if I was just projecting my own ideas onto the abstract. So you want to make sure that the coherence is pretty high. And then lastly, of course, importantly, diversity, equity, inclusion. So to what extent does the abstract attend to issues of social justice, of diversity, privilege, and oppression? And this is incredibly important because this is the foundation and the values of our faith, right? As the Muslim Mental Health and Islamic Psychology conference. And so to what extent are you indicating the use of the implications of your work is going to assist with disparities, for example? To what extent are you indicating or being cognizant of the ways that social identities like race, ethnicity, gender are actually impacted by the work that you're doing? So this is the call for reviewers. You should, hopefully you've gotten this email if you've already gotten the email for the abstract info sessions. And so it's going to give some critical dates for the review process. If you're interested in being a reviewer, we encourage you to apply. And then the selected reviewers will be notified in October, but the abstract review period is going to be 2 weeks in November. So, which means that then abstracts will be notified in early December. That's when people will know about whether their abstract were accepted or not. So that is everything that I have for today. So I want to open it to any questions that you have. I welcome talking about any ideas or anything that, may seem confusing or any way that I can be of assistance.
I just want to thank you. This was what we needed.
Yeah. Thank you, Dr.
Thank you, Hanan.
Thank you.